Nurse Practitioner Yvonne. I am going to do your physical assessment today, okay?
Okay.
So what brings you in?
Just a checkup.
Just a checkup? Okay. Well, let me do some hand hygiene and then we're gonna go ahead on and get started, okay? All right, so we obtained her height and her weight outside. Right hand hygiene performed. And could you tell me your name, date of birth, and where you are?
Cena Schmucker, 4588, and I'm in Dunedin, Florida.
Okay, so her, she's aware of where she is. Her orientation is in check. All right, I'm going to take your vitals and we'll get started, okay?
Okay.
All right, go ahead and have a seat for me. Okay, 120 over 80. Okay, and then let me go grab a pulse ox. Okay, blood pressure was 120 over 80. Here's our pulse ox machine, and we're going to do your temperature. And again, we did the height and the weight outside. What's your height and weight, just for the record?
5 foot, 126 pounds.
Okay. All right. Heart rate is 98 and 97.8 is the temperature. All right. So I'm going to do some hand hygiene again. Just freshen up. Okay. So I'm going to take a look at her skull. Her overall general appearance is healthy. Her skin color is appropriate. She's warm to the touch. Everything looks great. Do some capillary refill. I know I'm moving a little ahead, but okay. So I'm going to take a look at your scalp, okay? There aren't any lesions. Everything appears normal and symmetrical. Looking at her face is normal and symmetrical. I'm going to go ahead and assess her temporal pulses. Now I'm going to go ahead on and I'm going to assess your sinus cavity, okay? And just let me know if you see any or feel any pain or swelling in that area.
No.
Okay, I'm going to assess your lymph nodes. I don't notice any swelling. That appears, the thyroid appears symmetrical. Go ahead and swallow for me. Okay, that appears symmetrical. Now I'm going to go ahead and look at your ears. Or swelling right there. How does that feel?
Fine.
Cool. And swelling. So I'm going to turn this on. I'm just going to take a quick peek into your ear cavity. All right, it's clear. No issues. Yay. It's clear, no issues. All right, we're going to get rid of this one. We're going to do a little bit of hand hygiene again. Okay. If you could go ahead on and tilt your head up for me, I'm just going to take a look inside your nose. No issues. Open your mouth for me. Okay. Let me get one stick. I'm just going to press on your tongue, okay? And I want you to say ah.
Okay.
1, 2, 3. Okay, the volar is moving with no restriction. Any pain or anything?
No.
Okay, now go ahead on and put one nostril down and try to breathe in as much as you can. Okay, no congestion noted. Go ahead and do the other thing, the other side, please. Okay, no congestion noted. Okay, now I'm going to take a look at your eyes and just assess the eyes.
Okay.
Okay, pupils light and reactive. They're about a 3. Okay, no issues noted with that. We'll put this down. Now, I am going to have you follow the stick with both of your eyes, okay?
Okay.
All right, we're testing the cranial nerves now. Okay. Everything is within normal limits. We're gonna do the other side. Okay, perfect. Everything is within normal limits. Okay, let me see what else. I'm not forgetting anything else. Okay, now we're going to assess your heart and your lungs, okay?
Okay.
So I'm just gonna take a listen to you. First, I'm gonna start with your lungs in the front and in the back, and then we'll move to your heart, okay?
Got it.
All right, any issues or anything like that noted? Okay. This is your left side, okay? Okay. Make sure the camera can see me. I'm sorry about the
No, you're good. Sorry, it's wet.
Yeah, how are we gonna do this? Okay. Okay, now I'm gonna check for any additional heart sounds that may be noted. Okay. No, only S1 and S1 are S1 and S2 are present. No additional heart sounds are noted at this time. Okay, so now I'm gonna take a listen to your lungs. Go ahead and breathe in and out for me. Okay. Oh, could you turn to the back? To the back. Breathe in and out. Okay. And then I want you to say, every time I move the stethoscope, I want you to say 99, okay?
Okay.
Go ahead.
99. 99. 99. 99. 99. 99.
Okay, and then the same on the front. You can go ahead on and turn back over.
99. 99. 99. 99.
Okay. Now we're going to do some percussion on the heart and the lungs. I'm kind of doing those together. The camera a bit closer. Okay. All right. So. I'm going to pull your shirt up just a little bit. Sorry. All normal findings, no dullness or anything like that noted at this time. And then we're gonna do your lungs, okay? So you can turn back over to the side of your arm. Now we're going to move on. We're going to listen to your pulmonic and your aortic artery, and then we're going to go on to your GI system, okay? All right, so if you could go ahead on and just lay down for me, I think that would be a little bit easier. Okay. All right. And this is me listening to her pulmonic and her aortic heart. I'm sorry, it's down here. So this is me listening to her renal and her other arteries, aortic and iliac arteries. Okay, now I'm going to listen for her bowel sounds. Okay, they appear to be in normal limits. Okay. Now I'm going to go ahead on and lightly palpate on your abdomen, okay? Okay. All right, so tell me if you notice any pain. We're going to start over here. And go ahead and cough for me. Any pain noted? Okay. Not noticing any enlargement, any of her organs. Yeah. Okay. And I would assess her femoral arteries, but per the guidelines, we don't actually have to assess them, but that's what I would do next. Okay, now let's do a little bit of percussion. Okay, so I'm just gonna touch your leg and bend it and just kind of see if you have range of motion in all areas, okay? Starting with this leg. All right, any pain noted? Okay. And then we'll do this one. Hip has good range of motion if the wall isn't there. Okay, so the hips had good range of motion. Now I'm going to assess your arteries. Your pulses. Why do I keep saying pulses? Those are +2. Bend your knee just slightly. Okay. And the next one that I would assess would be the femoral arteries in the groin area. And you can go ahead on and sit up for me, and I'm going to assess the rest of them and complete the range of motion. So let me see this arm. Okay, so this arm. Okay. Okay. And then we're going to do both of the carotids, and we're also going to check for jugular distension. Okay. Okay, could you turn your head slightly to one side? Okay, don't notice any protruding or anything in the area, and please turn to the other side for me. No protruding or anything in the area. So I'm actually going to listen to the carotid, because I don't think I listened to it before. Assess the bruise. I think I did, but I'm not sure. Okay. And then this one. Okay. All right. Now we're going to do some range of motion. Okay. I'm first going to start with your head, and if you can go ahead on and just try to push against my hand. Okay. And with this side. Okay. And then. Alright, and then with this one. Okay. Go ahead on and move your head up, down, to the side. No issues with that. Okay, go ahead and put your arms out to your side. Shoulders are symmetrical. Can you move your hands backwards? Can you move them forward? Okay, can you move them that way? Yep. Up and down. Okay, and she can. Let's see. Let me look at her skin. Skin is within normal limits, assuming if I was looking at the whole body, I would assess the whole body. That's within normal limits. If you could stand up, I'm just going to check and see if she has any varicose veins or anything like that. No varicose veins. Can't really see due to the socks, but it's okay. That's why we wear them. Okay. No varicose veins. And if you could stand on one leg, we're just going to assess your gait. If you could stand on one leg, okay, and then stand on the other leg, okay, and then touch, as you're standing on one leg, touch the opposite hand to your nose. So your other hand.
I'm sorry.
That's okay. All right.
Alright, so we want it like that?
Yes.
Okay.
All right, and then do the other one with your other hand, the other leg. Okay, good. Okay, and now I'm gonna have you walk. I'm gonna see if you can walk in a straight line and tiptoe. So go ahead on and get up for me, and we're gonna do that now.
Okay, so you want to do like heel to toe?
Yes, ma'am. Heel to toe, just like if you were getting an infraction. Okay, good. And then walk back on your tiptoes. Good, good. Okay, now we're going to do a visual acuity test, and please keep in mind we are working with what we got. So this is what we got over here on the wall, okay? So tell me, read to me with one eye closed the words on the wall, and the patient is about 20 feet away.
Alright, so.
One eye closed, okay?
So. FELOPZD.
Okay, good. Patient has 20/20 vision in the left eye.
And then FELOPZD.
Okay, patient has 20/20 in the right eye. Okay, and that will conclude our test. Thank you very much. Thank you for being my patient. Bye-bye.